Later today, Hartford HealthCare will host a simulation with 47 live actors challenging teams to respond to an explosion and secondary blast at the hospital. Now, it's being done to test their ability to handle a range of critical injuries and emergency situations. Joining us this morning to talk about it is Stephen Donahue, Director of Operations at Hartford HealthCare Center for Education, Simulation, and Innovation. Sir, this is a very, very important thing you're doing this morning. Why is this mass casualty simulation so important to the hospital?
Yeah, good morning, and thank you for taking the time to talk about this. I think it's very important for us to do these drills to make sure that our personnel can handle a mass casualty and handle any situation that may arise, so they know how to react.
Now, what exactly is going to happen later on this morning? Can you give us
Yeah.
kind of a blow-by-blow of what's going to happen when this simulation happens and takes place?
So behind me, you can see right now, this is my moulage team. We're in the process of moulaging our 47 victims that will be at a local venue. There'll be an explosion at this venue. They'll be brought, and many will show up at the hospital on their own. And then there'll be a secondary explosion here in the hospital after an incident of terrorism.
Now, what are some of the challenges these teams are going to face? And I would imagine this is really critical that they face and learn how to deal with these really high-pressure situations of this nature.
Yeah, the goal today is really to push their ability to work as a team, to handle a lot of patients at one time, to work on their triage skills, but also push the environment of the hospital to make sure that we can handle these patients when they come in. Do we have enough supplies? Do we have enough equipment? Do we have the right personnel here?
Now, I would imagine this type of training tells us a lot about Hartford HealthCare and your commitment to dealing with these kind of crisis situations.
Yeah, I mean, Hartford Hospital is here to serve the community, and we are going to be a primary site if these incidents were to occur. So it's very important for our emergency room personnel to be able to handle a mass casualty situation.
All right, and is this something you do every year, and do you kind of make things more difficult every year? Do you continue to increase the pressure on these teams?
Very good question. Yes, it is something we do every year, and it takes us almost 8 months to plan this out and execute it in each year's theme base, whether it's a viral component or is it going to be a mass shooting, or this year will be an explosion. So we always try to change the scenario and push the envelope with our teams.
All right. Stephen Donahue, Director of Operations, Hartford HealthCare Center for Education, Simulation, Innovation. Thank you so much for joining us, and best of luck with that simulation later this morning.
Thank you again. Thank you for telling the story. Thank you.
Still to come.